covering the stories that impact your life, your town, your state, and your future. This is the Means Report with your host, Brad Means.
Hello, everybody, and welcome once again to the Means Report. We certainly appreciate you spending part of your day with us, focusing on two key issues today. One is the health of your brain. What could be more important than that? In our second segment, we'll tackle children and anxiety and other issues that might be bothering them these days. A child psychiatrist on hand to discuss that with us. But first, let's get our neurologist started. He's Dr. John Morgan, specializes in movement disorders at Wellstar MCG Health, and he's a frequent guest of the Means Report over the years. Dr. Morgan, thanks for being back.
Thanks, Brad. Glad to be here.
All right, I just figure we will jump right into this and address it, and then we'll talk about brain health issues in general. But first, let's talk about President Joe Biden. There's a lot of talk in the news these days, and has been, about his health, especially his mental health. When you watch President Biden, do you see anything, the way he moves, the way he talks, that might cause concern as a physician?
Well, I'm trained in both memory disorders and movement disorders over the years, and I've done neurology for 20 plus years. So when I see Joe Biden on television, I can't help but watch him for his movements and listen to what he says. One of the things I notice about his movements is that he's slow, he's stumbly when it comes to stairs or getting his foot out of a bicycle pedal, those kind of things. And he walks with stiff arms and not much stride length, turns with his whole body versus turning with part of the head and leading and turning and twisting. So he looks a little Parkinsonian, I would say. I don't see obvious tremors in him on one side or the other, but anyone that looks at him would say he's a little Parkinsonian. I've heard from the records, medical-wise, that's ascribed to spinal stenosis or arthritis in his joints and back and spine, but I'm not so sure.
You know, not to get too political here, but just from a clinical standpoint, might those things that you say you notice impact one's ability to lead a nation or go to a job each day?
That's just the physical parts I described. The cognitive parts are definitely there too, of decline that I see. So he has word-finding difficulties. He has had numerous memory errors that are very evident. In the special counsel, when they were investigating him, he couldn't remember when he was vice president, couldn't remember a lot of different things. And then when he tried to defend himself, he didn't do such a good job of that either.
Let's go to the movement disorders to continue this conversation, Dr. Morgan. And let me ask if there have been any advances, certainly since we last spoke, in this area, something that can help those disorders improve the lives of people with Parkinson's?
Yeah, there's been a lot of advances in medications. A lot of it has been repurposing old drugs, like amantadine has become a new drug called brand name GoCovery.
Why'd they change the name of it?
Just it's a brand name, but the way it releases in the body is smoother and better for patients. And so I've noticed that for patients that have like Michael J. Fox writhing and twisting movements, that this medication, GoCovery, actually has better effects than the old amantadine by itself, it seems.
Are y'all doing any research right now or any, what's the word I'm looking for, trials where people can take part or are currently taking part in Parkinson's treatment?
We always have trials open.
Yeah.
The classic trials that are usually open are those for folks that are on carbidopa, levodopa, or Sinemet, the most powerful drug for Parkinson's that most people take. And they have wearing off of the medication between doses where their symptoms come back. So we have a lot of different treatments for wearing off. And we also have a drug we're studying for dyskinesia as well.
And what kind of changes have you noticed in the trial participants? Is it drastic?
Sometimes it is. Sometimes folks have amazing responses and sometimes not so amazing, or they have side effects. And so that's why we do the research. And that's why we have placebo treatment so that we can sort out what's real and what's not.
What about the dementia side of things? You told me about an antibody right before we started recording that sounds amazing.
Yeah, so there have been 2 antibodies approved by the FDA. One is now off the market because Medicare doesn't pay for it. But the one that's currently approved by the FDA is called lecanemab or Leqembi. and it attacks the plaques and tangles of Alzheimer's disease. It's made of a protein called beta amyloid, and it actually clears it. There's another one coming from Lilly called donanemab, which I don't know the brand name for yet, but that will likely get FDA approved as well. So we'll have at least 2 antibodies that attack amyloid and clear it. But here's the kicker. At 18 months of therapy, twice monthly with lecanemab, patients decline 30% less.
Oh my word.
With lecanemab than they do with placebo. So we actually are modifying disease, at least in the short term, right now.
How much is lecanemab?
About $5.
About $5. Okay, and insurance it typically covers it?
Yeah, $26,000 or something like that.
Oh no, no! I was so excited. So $26,000, and will insurance kick in?
Somewhere around 20. I may have that number a little off, but
sure.
But insurance does cover it, and as a part of the workup for it, you actually have imaging proof or spinal tap that you do have Alzheimer's disease.
Let's talk about causes of movement disorders. We'll go back to that. I know we're bouncing back and forth. Is this something that's primarily genetic, or can an injury cause a movement disorder?
Well, everyone's familiar with the movie about football players with head trauma and chronic traumatic encephalopathy,
right?
CTE. Mm-hmm. And certainly folks that have significant head traumas, multiple times, multiple concussions, multiple head traumas, have higher risk of both dementia and Parkinson's disease. They also have higher risk in many cases of ALS as well.
Do dementia patients hear you when you sit beside their bed and talk to them?
Yeah.
Yeah. I've always wondered about that. When you know, because people will say it's good to just go sit next to a loved one and have a conversation even though they can't talk back. What do you think about that?
I think social stimulation at all and interaction at all stages of dementia is useful, unless it agitates someone.
We're going to talk about your Brain Health Symposium that's coming up. I know it's near and dear to your heart, and I didn't want you to think we were going to skip it. I just wanted to update the folks on some of the things that are going on in your area of expertise. What about, and I ask this every time, the warning signs of dementia versus just having a senior moment, because sometimes it's hard for people to tell.
Well, as I mentioned before, we call a lot of times when folks can't remember stuff, CRS, can't remember stuff.
Right, yeah.
Right.
And that's normal.
Yeah, so you go into a room and you forget what you're going in there for, common. You forget someone's name and it comes back to you later, very common. Or you forget a word, you can't quite pull it up, but it comes to you later. So all those are normal things. As long as they come back to you later, where you can retrace steps, you put the keys beside the milk in the refrigerator because you were putting the milk up when you had the groceries, and then you find the keys there and you're like, how did they get there? If you have no clue, then that's a problem. Mm-hmm. But if you're like, oh yeah, I was putting the milk up and I dropped them there.
Okay, then you're probably okay.
Probably okay.
What about the long-term memory in a dementia patient? And don't let me misspeak here, but it seems to me that they're really good at remembering things long ago, those who are suffering, but not so good with short-term. Is that accurate?
Yeah, I've got a great illustration of how to think about that. So if you have a memory that you've remembered a bunch of times, like I remember going to Paris, and it was a great trip, and I saw the Eiffel Tower, and I did this and I did that, and you remember that for 30 years. It's stuck hard in steel in your memory part of your brain.
Yeah.
Okay. It's laid down in steel. If you went to the grocery store yesterday and picked up a watermelon, and your family asked you, where'd you go yesterday? That's just one day of memory over a short period that's laid down in straw or sand that can easily blow away.
Okay, that makes sense.
That's the way to think of it.
That's helpful.
Yeah.
A lot of helpful things going on at the Brain Health Symposium that's coming up on April 20th. You're kind enough to do this each year. You excited about this next event?
Very excited. We have a lot of great speakers coming. Our whole team will be participating, and should be a great event.
And so what can people expect? Does it cost anything to get in, or can you just go down there? Where's it being held?
It's at the Harrison Commons building.
Yeah, what a beautiful facility.
Yeah, on MCG campus, a really nice facility that has 2 big rooms for lecture halls. And one room will be focused on Parkinson's disease, and the other room will be focused on dementia and Alzheimer's.
You want patients or loved ones or both to come?
Both.
Yeah, and what can you do for the patients? Can you treat them there?
Well, we got free lunch and free breakfast for you.
All right, we'll take that.
Yeah, so we got some free meals.
Yeah.
But we have topics in the Alzheimer's side I'm going to talk about Alzheimer's 101 versus dementia and the differences in various levels of cognitive impairment and senior moments and all that. And then Dr. Jim Law is coming from Emory. He's a big researcher, and he's going to present a lot of the research data that's out there for Alzheimer's and dementias. And then Eli, Prince Coleman, she's my PA.
Yeah.
She's going to talk on sleep and other problems that happen with dementia. We have an elder law attorney, Patrick Smith, that's coming.
He does a great job.
Yeah, he's going to talk about dealing with those issues as you age and maybe get dementia or Parkinson's and how to live with that. The Parkinson's side, our newest faculty, we'll talk about where we've been and where we're going. Jessica McClard, she's a movement-trained neurologist with us. Dr. Colin McLeod is going to talk about the surgical treatments for Parkinson's disease. And then Dr. Curick is going to talk about palliative care and comfort and end-of-life kind of issues, not always end of life, but just comfort and how to make someone feel better about living with Parkinson's.
Last question for you, Dr. Morgan, and I ask you this every time as well. How can we maintain optimum brain health?
So I would say there's numerous things that we can do ourselves. Choose your family wisely.
Yeah.
That's already done.
You have no control, do you?
Don't drink too much alcohol. Drink a little bit, maybe.
Mm-hmm.
Exercise body, definitely. Physical exercise, getting your heart rate up, whatever you can do. Walking and gardening is enough to do enough exercise.
What about Wordle, crossword puzzles?
Yes.
You love those?
Cognitive exercise, but really not just doing the same thing over again every day.
Oh.
Novel tasks.
Okay.
So physical exercise and cognitive exercise appear to show increases in brain size.
Mm-hmm.
And we know that as you develop dementia, your brain shrinks.
All right, and we want to stave that off as long as possible, and
Yep.
there are ways that we can do those with and without medication. Dr. John Morgan, thank you so much for your efforts on behalf of those who deal with these issues, and thanks for taking the time today.
Thanks, Brad.
Absolutely, always good to see you.
Good to see you too.
When we come back, we're going to talk about children and anxiety and what makes them upset in their world. Sometimes as grown-ups, we feel disconnected. Dr. Dale Peoples is a psychiatrist. He'll help bring those issues to light on the Means Report.